Welcome, everyone. Thank you very much for joining us. What is the last kind of breakout session of the day? So before we close, so I wonder whether I should get you all to run on the spot after lunch to get the mind and body working again. Welcome. Thank you for joining us in taking action to prevent suicide. Particular welcome to everybody online as well. My name is Catherine Thompson, and I head up campaigns and marketing for the International Association for Suicide Prevention. A little bit of context before we get into the session itself. A suicide and a suicide attempt is devastating for the individual and for those around them. 700,000 lives lost and countless others affected around the world each year. Suicide is complex and a multifaceted issue, and when we think about preventing suicides, that's what we want to be thinking about in all your countries around the world, and how we can advocate and what we can achieve through the sharing of our strategies and thoughts and ideas around this today. The criminalization of suicide is a primary barrier, and one that our working group focuses on. It's a barrier that undermines national and international efforts to build effective strategies and policies to prevent suicide. It is a primary focus of our working group. But when we talk about decriminalization and the significant positive steps that have been made in the last 6 months, it also brings out other considerations, and that is that what happens next? Where do we go from here? Once we've decriminalized, it doesn't necessarily, removing the legal framework doesn't necessarily bring about change in other areas related to understanding and stigma and shifting policy and building strategies within a government level. We've been privileged as an organisation to work within the Global Mental Health Action Network to be able to discuss some of these challenges and share these thoughts and experiences within our working group. So, if this is something that is of interest to you, please do join our monthly calls. It's a wonderful space to be able to share what you've been working on, to share the challenges that you face, to share what you're aiming to do, both at a community level, a government level. And so we have invited speakers, and we have significant strategies and action points throughout the year. So if you would be keen to join us, then you're very, very welcome. So, while we get into what we want to achieve today, primarily this is an opportunity for us to share what's been going on, to share the resources and the key ideas around suicide prevention in your countries. To share efforts that have, and the significant developments in decriminalization. We're privileged to have a number of key players at national levels that have been spearheading those efforts in the countries that have recently decriminalized. So that's Pakistan, Guyana, Ghana, and most recently Malaysia. So it's a really positive space, and we want to keep that momentum going and to see that provides some thought and inspiration to those other countries that are looking to decriminalize as well. What we would also like to do is to look to building a call to action document that outlines really some guiding principles or some member priorities from the discussions that we have today. And this, we hope that we can bring together and to form a document that will inform and direct some of the focus of what we achieve within the working group going forward. So there will be 3 breakout sessions for those in person, and there are 3 boards around the room. And I will detail what those are. For those that are online, there won't be breakout sessions, but there will be 3 questions, 1 question coming from each different session, and that will be facilitated to bring an online discussion on board, and we'll ask an individual from online to feedback into our overall feedback at the end. So, with thanks to my colleagues for taking part in the breakout sessions, there'll be 20 minutes, and then we'll give everybody the opportunity to turn around and have another 20 minutes if at a different discussion in a different breakout session. Those you don't have to change if you're involved in a really in-depth conversation, but also there is opportunity to share different insights around the room. After the breakout sessions, we have 3 fabulous posters dotted around the room, and I would like to give the convener of those posters an opportunity to just say a few words. So we have a poster on the decriminalization efforts in Kenya. We have mindset in Ghana presented, and we also have the status of suicide in Bangladesh as well. So please do take the opportunity to look around the room. We'll see if we can take some pictures and maybe post those to those online as well. So if there's any questions around those, there'll be an opportunity at the end to feedback. So I'll introduce the breakout sessions. We have breakout discussion 1 is data and suicide prevention policy. So this is really the intersection between research, data, and how it informs policy and our advocacy as a result. With thanks to Wendy and Harun for facilitating that session. There are 3 questions within it: how to advocate for suicide prevention policies and ensure they are implemented, what should a good suicide prevention policy contain, and how to address data gaps and use it to inform policy. Breakout session 2 is suicide decriminalization advocacy, and with thanks to Nii from Ghana and Derrick from Uganda, who will be helping facilitate that session. This is in Nii and in Derrick. There are sharing of experiences around a recently decriminalized country, as well as one that continues its efforts along this process. So 3 questions are: what are some of the best strategies to get suicide decriminalized? What works and what doesn't? Who are the key stakeholders to engage? What resources are available, and how we can build on existing momentum. So thank you, Derrick and Nii. And finally, breakout discussion 3 is community level work, helplines and services on suicide prevention. And with thanks to NAB and Priti for taking on the facilitation of those sessions. The 3 questions are: what are some effective social and public health approaches to suicide prevention? Effectiveness of helpline/technology-based supports to prevent suicide, and what a good helpline or technology-based service looks like. and how to address stigma and cultural barriers that prevent access to services. So, on that note, and without taking up any more of your time, thank you to all who've involved. Please do choose data and research, decriminalisation, or community work and helplines, and make your way to the respective discussions. I'll give a notice after 20 minutes for those that might want to shift and move to a different discussion. And then we'll reconvene after a following 20 minutes to bring the group back to a discussion. Thank you.